USMLE-style question on Gallstone Ileus. An 80-year-old woman with a history of chronic cholecystitis presents to the emergency department with abdominal pain, nausea, and vomiting for the past 2 days. She reports intermittent episodes of similar pain over the last few months. On physical examination, her abdomen is distended with high-pitched bowel sounds. A CT scan of the abdomen reveals pneumobilia, air in the biliary tree, small bowel dilation, and a radiopaque mass in the terminal ileum. Which of the following best describes the underlying mechanism of this patient's condition? A. Ischemic necrosis of the bowel wall due to venous thrombosis. B. Volvulus leading to closed-loop obstruction. C. Impaction of a gallstone in the ileocecal valve after passing through a biliary enteric fistula. Intussusception due to a lead point in the small intestine. E. Strangulated hernia causing bowel obstruction. And C. Impaction of a gallstone in the ileocecal valve after passing through a biliary enteric fistula. Explanation. This patient has Gallstone Ileus, a rare complication of chronic cholecystitis where a large gallstone erodes through the gallbladder wall, forming a cholecystoenteric fistula with the GI tract, most commonly the duodenum. The gallstone then travels through the intestines and lodges in the ileocecal valve, which is the narrowest part of the GI tract, leading to small bowel obstruction. Classic findings on imaging include pneumobilia, air in the biliary tree from the fistula, small bowel dilation, proximal to the obstruction, gallstone in the intestinal lumen, often at the ileocecal valve. Option A, ischemic necrosis due to venous thrombosis. Describes mesenteric ischemia, which presents with severe, out-of-proportion pain, but no pneumobilia or gallstone. Option B, volvulus leading to closed-loop obstruction, is incorrect because volvulus involves twisting of the bowel, typically in the sigmoid colon or cecum. Option D, intussusception due to a lead point in the small intestine, is more common in children and presents with a current jelly stool and a target sign on ultrasound. Option E, strangulated hernia causing bowel obstruction, would present with a palpable, tender hernia, but not pneumobilia or a gallstone in the intestine. Thus, the correct answer is C, impaction of a gallstone in the ileocecal valve after passing through a biliary enteric fistula.